Hi everyone, welcome back. So today we're going to be discussing fibromyalgia. Today, this is most likely the one condition that you guys have heard of. This has gained a lot of popularity in the last few years, and this is for a good reason. That's because there's more recognition about this disease and it's getting more research, and this is an amazing development. But again, despite the increased amount of research, there is still a lot of stigma, a lot of bias about this disease, and there's also a lot of socioeconomic factors that are not really examined. So today we're going to be looking at what this disease is and what are some ways that it amplifies and plays into the socioeconomic inequalities in America and around the world. So it is difficult to define what fibromyalgia is because again, it's still an ongoing research process, but some of the prominent symptoms are pain, fatigue, sleep problems, and muscle tenderness. There can also be digestion problems, light sensitivity, noise sensitivity, memory fog, and it can be a debilitating disease. So, again, I have met many patients, not just with fibromyalgia, but also with chronic fatigue syndrome, and I've talked with them, and they talk about how difficult this condition is, and they talk about how some days they can't even get up, and some of them talk about the fact that once they are doing any chores or walking around, there's so much pain and fatigue in their body that they are not really able to do anything else, and that has led them to not socialize anymore, not really be able to work anymore. So there's a lot of problems that comes with fibromyalgia. And again, this is not just unique to fibromyalgia. Chronic fatigue syndrome and gulf war illness also exhibit these, and this is one of the reasons why there is a lot of confusion about how these diseases differ from each other, especially between fibromyalgia and chronic fatigue syndrome. And we will define that later, especially for chronic fatigue syndrome, because the symptoms are very similar. But again, one of the main thing to emphasize is that fibromyalgia is more focused on pain, and chronic fatigue syndrome, as is indicated by name, is more focused on fatigue. But then, of course, they can exhibit fatigue and pain as both of them. So there is a lot of research focusing on fibromyalgia, including the lab that I'm working in. So the hypothesis that our lab is working on is the neuroinflammation hypothesis, so I should clarify what neuroinflammation is. So inflammation is an immune response where cytokines are released, and this is similar in the nervous system, and that when this immune system response happens, it's neuroinflammation. So when cells such as astrocytes are released, when cells like astrocytes release cytokines, there is inflammation that is triggered, and this is usually to combat a pathogen. However, this inflammation process can also be triggered even when there's not a pathogen. And this is what we think is causing fibromyalgia, as well as other conditions like chronic fatigue syndrome. And there is a lot of research evidence to support this, one of them being the fact that the primary motor cortex in the brain has increased neuroinflammation in patients with fibromyalgia. So, even though there's a lot of research on the biology and the origin of fibromyalgia, there's not as much research and data on how fibromyalgia impacts people and groups and demographics differently due to social inequities that are present in our society. So, as with many other conditions, it has been found that racial minorities experience fibromyalgia with more severe symptoms. So, some of the possible side effects of fibromyalgia include depression, sleep disturbance, and mood problems, and African Americans tend to experience these problems much more severely than Caucasians. Yet, interestingly enough, fibromyalgia is actually disparagingly known as a white woman's disease, at least in the research world, because there are a lot of patients that are white. But we're actually going to see what this may be due to. So there are a few studies that examine how historically marginalized communities especially African Americans, are impacted by fibromyalgia. Um, there are some red flags that emerge. So, in general, not just for fibromyalgia, Black patients are much less likely to obtain a diagnosis for any pain they're experiencing, and actually, due to some antiquated beliefs about how African Americans experience pain, doctors do even administer lower doses of pain medications for Black patients. And these social inequities are not just in the treatment process, but they're also for how African Americans deal with the condition. So, a lot of people who have fibromyalgia, they are at least a little bit financially secure, or they're able to take time off of their job. But if you're impoverished and don't have a lot of social support and social safety net, then you're not really able to take time off of your job. And due to systemic racism, a lot of African Americans work in jobs, especially in the service sector, where they're not able to take time off, and therefore they cannot really take care of themselves, and they have to work through the pain and the emotional problems that fibromyalgia causes. Another reason that fibromyalgia plays into socioeconomic inequities is the fact that because there's not a whole lot of recognition in the medical community of fibromyalgia, and because it is very difficult to diagnose, where you have to eliminate every other condition that might be causing these symptoms before you can give the fibromyalgia diagnosis, patients very commonly see more than 15 doctors. And if you know anything about the cost of healthcare in the US, this is going to not just be a tremendous amount of time that patient has to spend, but also a tremendous amount of money. So if you're impoverished and if you're from a marginalized community, you don't have the luxury of going to 15 doctors. And so a lot of these patients who do get a fibromyalgia diagnosis are going to be white women who are more likely to be privileged and who are more likely to have the resources to obtain this diagnosis, whereas Black women and low-income earners may not receive even help for pain, and they might not even get a diagnosis. So again, we talked a little bit about the historical attitudes, but what are these historical attitudes? So in the medical community, professionals believe that Black women experience less pain, and they believe that actually it was okay to treat them inhumanely because they didn't really experience pain in their minds. But obviously this was predicated on racist beliefs, sorry. So, interestingly enough, the founder of gynecology, J. Marion Sims, he experimented on enslaved Black women. And he believed that he didn't really need to give them painkillers or anesthetize them during surgery, because he just believed that they didn't really experience pain, so he didn't really need to take any precautions. And of course, there was also a callous attitude that came from the fact that they were enslaved, so they had no power to object. Now, of course, this degree of blatant racism is no longer here, but there is still a lot of systemic racism embedded in medicine. So 12% of doctors, for example, think that nerve endings of African Americans are less sensitive, and 60% think that they have thicker skin, and as a consequence, they don't think that they can tolerate. As a consequence, doctors think that African Americans can tolerate more pain, or are not as sensitive to pain. And fibromyalgia is just a tiny portion of this problem. There's, of course, many other conditions that cause a lot of pain in the body. But again, fibromyalgia is not just influenced by the research community, who frequently dismiss it, but also by socioeconomic realities. So again, due to racial disparities and discrimination in employment, African Americans experience higher unemployment rates or work in lower status jobs. So it's more difficult for them to take time off from work in order to rest. They have a harder time getting a diagnosis, and even when they can get a diagnosis, they have a harder time getting the treatment for fibromyalgia, which can be therapy and which can be medications. And yet these are all very costly, especially for groups that are either uninsured or underinsured. Of course, there is light at the end of the tunnel. This is not a solutionless problem. First, we must emphasize building community centers that are good for individual and group sessions where people from socioeconomic low areas can come together and discuss their experiences. Again, one of the most important things about this disease is that a lot of people feel isolated. So it's very helpful for people when they can come together and discuss their experiences. There's also a lot of stigma around fibromyalgia, which makes people more depressed and less able to express their emotions. So these support groups will be a good support system and allow them to build resilience. There should also be a public health campaign to raise awareness about fibromyalgia, especially in these communities, so that they can go to certain doctors and get a diagnosis. So, this outreach program can have posters, advertisements in local TV and radio stations, and also public health officials should reach out to local community leaders, such as pastors, who have say and influence in the community, so that these influential community leaders can talk to their constituents and get them to act on and seek out medical help or help those with fibromyalgia. Overall, systemic racism is a massive factor in fibromyalgia. And so it is very important that not just for fibromyalgia, but in the medical community itself, we take steps to address inherent biases that doctors and other medical professionals have. We give them training about how to recognize and overcome these biases, and we also seek to correct some of the racist knowledge that has been passed down in medical schools and nursing schools and other training schools. So we seek to educate young healthcare professionals about what to do in case of fibromyalgia and other diseases, and also we train them about how to manage pain, and most importantly, we train them on how to recognize when there is racist information being passed around. So I will be posting the references that I use for this video in the link, and I want to thank you again for watching this video. And next video, I'll be discussing chronic fatigue syndrome. The one after that, gut wellness, and then I'll be discussing some more theoretical stuff. So thank you so much for watching, and please feel free to subscribe.